we would invite Kelly with a virtual clap all the way from Canada. India welcomes you, Kelly. Please be here. Type 111, type yes, yes, yes into your chat box. Kelly, welcome. You can unmute yourself. And we would want to listen from you live. Okay. We do not want a sales talk. We know you are not here for a sales talk. We want to really listen to your story, listen to your pain, connect to your sufferings, probably listening to your story and the benefits that you have experienced because of this water, okay, how it has impacted you. Probably somebody sitting in some part of the world watching this story, this live testimony, this video will feel that this can definitely make a positive difference in their lives too. Over to you, Kelly. Thank you.
Thank you. Thank you so much for having me. I'm extremely grateful to be here, coming from Canada. Just want to let you know that, as he said, this is my story. Kangen water has not healed me. That's why it's so important to get the machine for yourself, because if I do not drink the water, all of my symptoms return and I am in so much pain. So to give you my history, it's a little lengthy, but this is the first opportunity that I've been able to share it. So I'm going to share it with you. Back in 1999, I fell face first on a cement floor. I was at work. I lost consciousness and I tripped over a railway tie, which is a train track running through the building. I fell face first and I broke my mandible and I fractured my jaw. I split my chin open and I had basically went down like a tree and skidded across the floor. So I scratched up my chest. I was in the hospital for 4 days. They couldn't figure out why I blacked out or anything. They said, you know, next time sit down if you feel like that and don't walk. So I said, okay. So years later, I had, you know, they couldn't figure out what to do. I went through pain clinics and, you know, doctors were disagreeing and arguing, you know, orthodontists, periodontics, dentists, oral surgeons, you name it. I saw them. Nobody could figure out what was going to take my pain away, what was going to help me. And it was injections, Botox, cortisone, medications, you name it, making me a splint, whatever. So I had an x-ray done last year and my face is so full of arthritis that they can't believe that I'm able to talk and not have any issues. So that's the first part of my story. The second part was in 2004, I had a car accident. I was on my way to work, different job, different location, on my way to work. I wasn't going very fast and I lost control and rolled my Blazer onto its side. So I was hanging basically on my side from my hip. So I ended up with low back issues. I can't work over my head. I have neck issues. I can only look straight on for a long time. I can't turn sideways. So if you notice, if I'm in a meeting or anything, I'm sitting straight on to keep my head straight. With that, I had hip pain. The doctors were telling me, it's your back, it's your back, it's your back. And I kept telling them, no, it's in my leg and it's in my leg. And they kept arguing with me. And it took me till 2007 before I finally got in to see a specialist. So 3 years after doing physio, chiropractor, acupuncture, I even spent $500 on orthotics thinking that they would help me, and nothing was helping. I was on this drug and that drug. They kept having to increase. I walked with canes. I couldn't drive with my right foot. I couldn't even do stairs or even the simplest things of sitting on the toilet and holding your pants from hitting the ground. That hurt. So doing the simplest things was so painful to me. And, you know, when I talked to this doctor, I walked in and he didn't want to give up on me. So I ended up having multiple MRIs. I've had 14 MRIs in my life. I've had 2 arthrograms, which is where they take a big long needle and they stick it into your hip and they inject you with freezing, which I felt all of it. I wasn't frozen for any of it. And they couldn't believe of how much pain I was in because I was supposed to be frozen. But they assumed that it was bursitis, but nobody could show it on any tests that I had done. I walked into a surgeon's office in 2008 and he asked me what my problem was. And I explained, just like I explained to you. And he walked over and he touched me in the side of my hip and I basically collapsed. And I said, yeah, that's the spot. So he explained to me what bursitis is. And so, with this explanation, it made it really simple. So basically, if you take two heavy textbooks and you put them on top of each other and you put them on a table and you try and move those textbooks, they don't move very well. So if you take a small balloon and you put that small balloon between the two textbooks and you lubricate it a little bit, you're not lubricating underneath, you're lubricating between the two textbooks, it actually allows them to slide across the table so much easier because it's lifting some of that weight off of there for you. That's what your bursa does for you. And it allows you to move it across the bone. So because I was having problems with mine, every time I moved, it hurt. So he booked me in for surgery in 2009. He called me a week later and said he had an opening for me. And I was in my 20s and, you know, walking with a cane, and they didn't want this. So they got me in as soon as possible. So I had my hip surgery in September of 2008. I felt great. I had feeling back in my toes. My pain went away. I felt awesome. It was only the pain where I had the surgery. That was the only pain that I had. So I'm like, great, you know, this is good. I'm going to be able to get off my medications. I'm going to be able to feel better. Well, 2 weeks after my hip surgery, I had 32 staples in my hip. Another car hit me when I was going to work to get my separation papers so I could file for employment insurance. And I had a car accident. So it undid the surgery that I had done. All of my numbness came back. All of my pain came back. I couldn't stop using my cane. I had to continue using 1 to 2 canes, sometimes crutches. Medications were constantly being increased and nobody had any answers. After 10 years, they said, well, you're chronic. What do you want for pain? And I said, well, I don't want a drug. I don't want medication. I want to be able to live and enjoy my life. And I want to, you know, be and enjoy my 20s and 30s. Since I didn't have much time in my 20s to enjoy, I was paying from all of my 20s, basically. So after that, I was told, you know, if you get pregnant, you will not be able to carry your child because of your hip and all of the medications and everything else I was on. Well, I ended up getting pregnant in 2015. So I called my nurse practitioner because I hadn't gone to the hospital because my hip gave out on me and I had fallen down the stairs, and I was there for another reason. And they told me they couldn't help me because I was pregnant. So shock and awe. And now I'm calling my doctor and I'm like, okay, well, what do I do? And they said, well, you're going to have to go off all of your pain medication. And I just like, what? I can't do that. But I did that for my son because I knew if I continued being on the medication I was on, there was no way he would be born with so many birth defects and he would have so many issues. And so I went off of everything for him, and I went through, it was, you know, I was on the toilet with a bucket between my knees. I didn't know whether I was coming or going. I was such a mess. I lost so much weight from coming off all of that pain medication. I went through withdrawal so badly. I did not want to go back on the medication after I gave birth to my son, because of what I went through coming off of it. Doctors were surprised on some of the medications that they said, you know, like, there's no withdrawal. It's okay. You can just come off of it. Well, no, I corrected them on that very quickly. And you know, because I was a mess. So when I was pregnant with my son, I found out in April of 2015. In June of 2015, I found a lump. It was about the size of a grape. And with my car accident, this is where my seatbelt was. So it came right across here, and this is where my lump was. So it was about the size of a grape when I brought it to the doctor's attention. The doctors looked at me and they said, okay, well, we'll send you for an ultrasound. And they did. And they said, well, welcome to motherhood. It's nothing. I said, oh, okay. So don't worry about it. So I went on, and I was in so much pain, and I was so sick through my entire pregnancy. And people were really noticing as the pain was, as I was getting heavier, the pain was getting worse and worse. And I'm one who doesn't complain, and I try and hide my pain as best as possible, but you can see it in my face when I'm in pain, and it's clear as day. And so I'm sitting at my baby shower, and everyone's like, she's going to be having this baby soon. And I ended up in the hospital. My feet swelled like crazy. My body started to shut down. My blood pressure went through the roof. They didn't know what to do with me at my doctor or the hospitals because I didn't have any protein in my urine, which is a sign of preeclampsia. I didn't have that. So they didn't know what to do. So they sent me, after doctors had talked between, you know, this hospital, that hospital, one hospital, another hospital decided, okay, we can take her. So they took me. So I drove there, and they were surprised that I was even walking into the hospital at this point because my blood pressure was so high. And they, you know, they convinced me to have a catheter, and I tried to fight it so hard because I didn't want to go through anything else. And they said, no, we need to be able to measure your levels every hour, and we don't want you out of bed. So I said, okay. So they gave me an injection for my son's lungs, and they said, this is, you know, we're going to give you another one in 24 hours. So I thought, okay, I'm not having this baby within 24 hours. I'm good. You know, I'm going to get the second injection. Everything's going to be good. Well, this was at 32 weeks, 6 days. Well, the next day I was at 33 weeks. By 11 o'clock in the morning, I was 4 centimeters dilated, and they were coming in and breaking my water. I didn't have normal contractions because I've had so much pain in my life. The way that my body went into contractions is I literally shook. Like I just shake. And everything on me that was hooked up to me and my son would be dislodged, and they'd have to try and find him again, and they'd have to hook me up again. And I said to them, I said, well, I'm thinking my contractions are my shaking. So they started tracking my shaking, and they're like, you're right. So they started tracking the shaking, and it started getting worse and worse and worse. So then they came in and they gave me the epidural because I couldn't not have an epidural with my hip. So they came in and they gave me the epidural the first time, and they missed. So they had to give me it a second time, and they missed again. So they went for a third time, and my husband knows my sign. If I tell him my ears are ringing, I can't hear you, he knows I'm going to black out. So I told him this, and I could hear him because I couldn't hear him. I could feel him telling the nurse, and I could feel his strength strengthening up to hold me tighter because I was not allowed to lay down. So they had to hold me up, and I was out. I was out cold. So I woke up on the bed to them doing the ice test to see if I could feel anything, and I couldn't feel anything from my waist down. And I was so sick at this point because my liver had shut down. My kidneys were going into failure. Any water that I was putting in, I was just throwing it back up. Nothing was coming out of me anymore. So they told me I had to slow down on the water. And I said, but I am so thirsty. And every time I drank, I just threw it right back up. So finally, they woke me up because I was sleeping at this point, and they woke me up at about 5:15, and they said, okay, well, you got to push. And I looked at them, and I'm like, there's nobody in this room. Like, there's 3 nurses. I'm supposed to have like 5 people for me, 5 people for my son because like he's 7 weeks premature. And there's only 3 of you in here, and you want me to push? They said, no, it's okay. It's okay. Just, you gotta push. So, okay. So as I start pushing, all of the room just fills. There's now the 10 people that are supposed to be in there and my husband. And I'm on a mag drip. So because they're afraid at this point that I'm, you know, before all of this, that I was going to have a seizure. So they wanted to prevent that from happening. So what they did is they had everything come in, and within 3 pushes, my son was out, and they whisked him off to another room, and I didn't see him. I laid back down, and they said that I'm not allowed any visitors. I'm not allowed any excitement, because if I do, I could have a seizure. And they basically dumbed and dulled everything down so that way I didn't panic because they didn't want that. So I'm laying in bed, and my husband went and took pictures and videos of my son and brought them to me so that I could see him for the first time. And I had a nurse come in at night, and she's like, you know, I have this baby down here, and I was wondering why the mother wasn't coming to see them. And now I understand. Do you have any questions? And I said, well, my husband's filled me in quite a bit. I said, so I just really want to see him. So once the mag drip came out after 24 hours, I was able to go in and meet my son for the first time. He was hooked up to CPAP. He was hooked up to temperature. He was hooked up to heart monitors. He had so many gauges all over his body. I could barely see his face. I could barely see anything. And I put my hand beside his, and he reached for my finger. He knew I was there. And he grabbed my finger so hard, and it was just like, oh, melt my heart. So he spent 6 weeks in the hospital. He was born at 3 pounds, 7 ounces. He was extremely healthy compared to what I was expecting. He came off of his CPAP. They tried once and I wasn't there, and I kind of got a little upset with them. And I said, you know, can you please just wait and let him do it with me here? That way I can comfort him. He knew I was there by holding my finger. He knew my husband was there, even though he had the blinders on because he was under UV lights. He couldn't see us, but he knew we were there, and he held my husband's hand on one side and my hand on the other side. And I said, when we do this again, please make sure I'm here. So they honored my request, and we went down 2 days after he was born, and they removed him from CPAP, and he stayed off of CPAP at that point. So he was a strong little fighter. And so basically they figured by the following Monday, Tuesday, he was going to be sent to Sick Kids Hospital because he was so little. They'd never had a baby that little, but they were wrong. He stayed in that hospital. Within a week of being born, his IV was removed. He was on a feeding tube to be able to feed because his mouth was not strong enough to nurse. We did try the bottles. We did try nursing. We tried everything. And when he got too tired and too lazy, because little boys, sometimes they're really lazy and don't want to eat, we had to use the feeding tube to feed him. So he did spend 6 weeks in the hospital. So normally when they say that a baby's born premature, they stay in the hospital until they are full term, which would have been December 9th. He was born October 21st. So to, you know, like it's quite a while to wait. I, because of my health, couldn't be at the hospital every day. I spent a week in the hospital trying to get my blood pressure under control with medication so that I could walk from my bed to his bed. They tried to discharge me many times, and I looked at them and I said, if I can't make this walk from my bed on the same floor to his bed, there's no way that I can make the walk from the parking lot to the 6th floor to his bed to be able to feed him and bring you more food for him. So they kept me for a week until I was able to do that walk. And then I went home. Every other day I could go and visit him. I could not go every day because of my body. I was just in so much pain and I was in so much discomfort. And they were concerned that my breast milk would slow down. But fortunately for me, in the beginning, I had a lot of breast milk. So I was able to continue to feed them when I wasn't there, and I would pump at home. So because of that, and because of all the pain I was in, my milk eventually did slow down. But before that happened, Paul ended up with a red mark below his anus. It's called a hemangioma, which is a strawberry birthmark, which basically means that the blood vessels are on the outside of the skin instead of on the inside. So every time that you rubbed his little bum to wipe it, it rubbed a layer of skin away. So it ended up with a loony size, like a big size hole in his bum below his anus. And we had to do dressings and packings, and we had wound specialists in, and we had to distinguish what was going to help him, whether it be wet or dry, or, you know, what they were going to do, and all of this craziness. So they figured out what to do. So I helped the nurses, you know, because I was there for it. A couple of the nurses were there for it, but because every day there was different nurses in, I made sure that, you know, if the nurse wasn't sure how to do it, I showed the nurse how to do it. And I would be crying, trying to change his bum because he'd scream because it hurt so bad. So he was on Tylenol every time he had to get his bum changed. And he pooped 24 times a day and it was water. The reason being is we found out that he had a food protein induced enterocolitis syndrome, which is abbreviated with FPIES. So food induced protein, he couldn't have protein. So for me to eat milk or drink milk or have soy or beef would make my son, very, very sick. So I had to change my diet. I had to cut out a lot. And I have a lot of food allergies already. Like I can't eat nuts and fruit and all kinds of different things. So now I'm limiting myself even more. So basically I said, well, if it tastes good, I can't have it. So it was a very bland diet. You know, like I I ate a lot of vegan pancakes because it was something that I could digest, and I ate a lot of bacon and a lot of different things because it was something that I could eat. I couldn't eat a lot of things because of him. So he got better and he was able to come home, and I had to continue doing all of these diaper changes and packings and everything until January or February of 2016. So after I gave birth to Paul, my lump that was tiny started to get bigger. And I brought it to my doctor's attention. And she said, well, the doctors have said it's nothing. We're not going to worry about it. I said, well, it's really hurting me. And she's, well, I can mention it to the other nurse practitioner and see what she says. And nothing ever came of it. I was up at night trying to push on this, thinking it was a clogged milk duct, and it was hurting me so badly. It hurt so badly to try and nurse on that side. Beginning of April, I went to my appointment with my son at the hospital just for a follow-up. And I ran into the lactation specialist, and she looked at me and I said, can I ask you something? And I pulled down my top and I just showed her the lump, and she's like, oh my gosh, go get it checked. Be your own advocate. Push for yourself. You're the only one who knows your body. You need to push and not let them push you away. Make them do something. 2 days later, I lost feeling in my right middle two fingers of my right hand. And I got pain all the way down my arm. So I went to the hospital because they said they could get me in at the end of the month. That wasn't good enough. I went to the hospital to get checked. Well, the doctor walked in and said, I thought I was walking in here to a young woman over exaggerating, and my jaw just dropped. And I looked at him like, I can't believe that you're saying this to me. And I pulled down my top and I showed him and I said, like, I do not over exaggerate, and I am here because I was told to be here and you need to do something about this. He says, well, I will refer you to a surgeon and I will send you for an ultrasound and you guys can discuss what you're going to do at that point. And he walked out of the room. So I followed him. And I said, well, when? When am I going to have it? And he said, well, not today. It's Friday. I said, okay, so when? He said, well, we'll call you. So I said, okay. So I went home. Monday morning, 10 o'clock. I hadn't heard anything. I picked up the phone. I called them. When is my ultrasound? The ultrasound department transferred me to the mammogram department. The mammogram department, neither one of them knew who I was. So this was confusing me. So they transferred me to the ER department. The ER department's like, well, the doctor didn't do his job. He didn't fill out the requisitions. And I said, I was very adamant that I really needed this done. So can we get this done? So they said they were going to get the doctor to do it. The next day I called. Ultrasound department wouldn't listen to me and transfer me to the mammogram department. The mammogram department, I said, look, I am full of breast milk. You try and do a mammogram on me now, I'm going to soak your machines. You're not going to see a whole lot if your machines are soaked in milk, and I'm so full. So I made them transfer me back to the ultrasound department. They said, well, there's such a long waiting list. We only do them on Wednesdays at this hospital. And because you're young, it's going to be, the end of the month before you even get looked at. And I said, well, is there somewhere else I can go? They said, sure, maybe, you can go to the clinic up the road. And so they made me an appointment up there without even knowing what they were really doing. And so I made arrangements because they called me and they said, you're going to go for 2:00 this afternoon. So I made arrangements for my friend to watch my son, taught her how to do the diaper changes in case I needed it done, because he needed to make sure that he didn't have any issues. And so I went to my appointment. I walked into them handing me the telephone saying, your appointment's been canceled. I said, what? I just drove a half an hour here for you to tell me that my appointment is canceled? So I'm on the phone and they're like, yeah, they need a radiologist available at the time of your appointment. And they didn't realize that when they sent you over here. And I said, because nobody would listen to me. I said, like, you should be listening to your patients. You should be listening to the people that are needing the help, and not just, well, we know what we're doing, because you don't. We're paid to do what we do. But unfortunately, they don't always know. And since then, I have written a letter to the hospital and I have had that corrected. My story has been put into the training at my local hospital so that this never happens again to anybody, because I was very adamant that this is not the way that anybody needs to be treated. When I finally got in, I went to another hospital And I ran into a social worker there who they fell in love with me, and they fell in love with my son. And she said, well, do you know where the breast assessment center is? And she walked me downstairs and she said, well, here it is, and tell them who you are, and I'll make sure you have an appointment. And they said, yeah, I have an appointment for the next day. She said, well, that's not good enough. She has this preemie that she's going to have to drive over an hour one way to come here to have this appointment. We need to do something. So the team there got on the phone, made some arrangements. The social worker said, can I take your son for a walk? I said, sure. So I stayed there and I waited. She brought down a nurse with my son. That nurse watched my son while I went in and had an ultrasound and biopsy done. Like, they went above and beyond at this hospital. Like, I'm just extremely grateful for what they did for me. And within a week, I was told that I had cancer. They didn't know what kind of cancer or anything at that point. They just knew that I had cancer. And the surgeon I was dealing with wasn't going to be dealing with me because he said that I needed extensive treatment. So he was going to send me to the best surgeon in the world in Sunnybrook Hospital in Toronto. So okay, no problem. So I went home and I had to tell my mother, and I had to tell my husband, and everybody had to tell everybody. And, you know, my story quickly spread, and I had huge supporters, which was great because I had a 6-month-old son, you know, and there's no way that I could do this alone. So they said that I had to find a way to feed my son. So because I couldn't give him normal formula because his bowel would shut down and he would become very, very ill if I gave him anything. So I had to buy the most expensive formula there was. It was an amino acid base, so there's no protein in it. So that way I could start my treatments. Well, I started my chemo, and I had to have 8 rounds of chemotherapy. After my first round of chemotherapy, I started losing my hair. I started losing feeling in my fingers and my toes. I started getting mouth sores. I went to my second round of chemotherapy. They gave me mouthwash and, you know, rinsed and everything else that I needed for that. And then by my third chemotherapy, they had to cancel one of my chemos because the side effects were so bad. They had to do a dose reduction every time I went to chemotherapy because I was getting worse and worse. And after I did the first 4 rounds of chemo, they switched to a different chemo. And that chemotherapy I was allergic to. So basically, I had to go on so many drugs, so many steroids, you name it. I was on it. Like, it was 5 pills before they gave me my chemotherapy. And then I finished those. And I'm like, okay, good. Now I can heal. Then 6 weeks after that, I went for my surgery for my mastectomy. I had my mastectomy on the right side. They removed lymph nodes because it had spread to my lymph nodes. So they had to take lymph nodes and see how far it had spread. And they basically, they said that, you know, everything's going to be good. Well, 2 weeks later, I went back to the hospital and I said, I have a hole in my chest still. And doctor said, don't over exaggerate. She pulled back the band and she's like, oh, you do have a hole in your chest. I've never seen this in 33 years. And you have a big hole in your chest still. 2 months, I had that hole in my chest, and I ended up with a double chest infection, hospitalized twice from that, because my body was just in such bad shape after the chemotherapy and after everything I had already been through. So once I got healed from that after 2 months, basically I had to go for my radiation. I had to have 25 rounds of radiation. The doctor's like, you know, the first couple of weeks is going to be okay. After that, you'll slowly start to feel burned. After my first round of radiation, I burned. I couldn't hold my son. I couldn't lift my son when I had my mastectomy for 6 weeks. I had to give my son away every other week for my chemotherapy. And now I couldn't hold him for the 5 weeks that I was going to be doing my radiation. So the first while of his life, I missed out on quite a bit. So then after that, I started to get better because I was done all my treatments and yay, I'm cancer free, you know, but I had a lot of healing I had to do because my body was in such bad shape. I had no feeling in my hands and my feet. If I got cold, I shook. I looked like I had Parkinson's disease. I couldn't barely speak. I was losing my brain function. It was becoming so bad. And the doctor's like, well, it's not from chemo. And I said, well, what else is it from? I never had these issues before. I hurt my finger and I'd black out on the floor. My husband would come in the house and have to pick me up off the floor. And it's like, I didn't do anything. I just jammed my finger. I'm sorry. Like, I have no clue. And I'm apologizing for being passed out on the floor just because my husband has been through so much at this point. And I'm like, this is crazy. So I said, I don't know what to do. So the following year, I was in the hospital again. They couldn't figure out what was wrong with me. I was losing my speech when I wasn't cold. I was losing my vision. I couldn't look at lights anymore. I didn't have any balance. I didn't have any reflexes. Like, the doctors are checking me for stroke, TIA. They're checking me brain tumors. They're checking me for everything. And they can't find nothing wrong with me. So they said, if I get worse, I need to go back to the hospital. Because they couldn't keep me because they didn't know what was wrong with me. So they sent me on my way. Well, I was invited to a health and wellness benefit. And I was adamant, whether I was dying or not, something was telling me in my heart, I needed to go to this health and wellness benefit. And I walked in the door and I saw clothing and I saw essential oils and people testing your blood to see what you can eat and can't eat, and teeth whitening and water, like crazy water people. And I'm like, I drink water every day of my life. I drink nothing but well water. There's no chemicals in my water. I don't need to hear about water. I'm sicker than anything and I drink water. So I went over to the side and they were giving out water and wine, and I don't drink. So I got a glass of water because I didn't left my bottle of water in the car. So I went and I got it, and they turned around and I'm drinking this glass and I'm barely walking with my cane. And I went and I sat down, and another, a styrofoam cup, just a coffee cup. I went and I got a second glass of it, and I'm looking and I'm like standing in the middle of the room, and I hung up my cane and I'm looking up at the lights and I'm like, what is going on with me? Something is going on, and I could feel the difference. I could feel my body waking up. So I'm like, I had to go get another glass of water, and I had to go talk to these crazy water people, because maybe they're not crazy once I found out it was their water I was drinking. So I went and I talked to Sylvia and Frank, and Sylvia started to, I told her I was a breast cancer survivor, and that was it. So when I talked to her, she was explaining the science to me, and I kind of was like in la la land, like, I'm enjoying this way too much. I'm not understanding what you're saying. And Frank grabbed his jug of water and said, where's your vehicle? I'm putting this in, and you're going to drink as much as you can as quickly as possible. So I'm like, okay. So I normally I'm in bed at 9 o'clock at night. With the fatigue is so bad, I can't even open my eyes. You can't wake me up, for the life of me. I'm sleeping. 3 o'clock in the morning, I'm still yip, 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 yip. And I couldn't stop talking. I was like, oh my gosh, I can't wait till 6. I think, what time is it? It's 3 o'clock. Okay, well, I got to go to bed because we got to get up early. But I want to call Sylvia and Frank. Oh, I can't call them at this time. So what time can I call them? And I'm like, okay. So I waited till 9 o'clock. I called Sylvia, and I'm like, how do I get more? She's like, well, come and see me. So every 3 days, I drove an hour and a half one way with my son to go get water. I needed this in my life. It took me 2 weeks to convince my husband to let me buy it, because every time he said, well, you would get better, and then there'd be a crash. Like, I would get worse. And then I'd have a new drug and I would get worse again. And then I get better and then I get worse again. So they're like, well, I'm told there isn't a crash with this. I said, even if it gives me 1-2 months of me being able to play and run with my son and sit on the floor and not be able to get up and move, I want this. I need this. It's worth the money to me. So my husband said, fine, order it. So I ordered the machine, and I didn't even wait for him to install it. I installed it myself, because I'm like, I need this. I need to start drinking this fresh. So I started out at 8.5, and I started very slowly. The reason I started very slowly is because I don't just have all the body issues. I also have had 4 concussions, and I've also had the chemotherapy did a lot of damage to my brain. So I had to drink it very, very slowly. And I put the Himalayan salt in my water, because I talked to Dr. Corinne Allen, because I also suffered from PTSD, which gave me anxiety and depression very badly, because your world just comes to an end when you're done cancer. And I was so strong for so long, and I was so strong through all of this stuff, and I had to keep fighting for myself. I couldn't fight anymore, but my brain finally said, enough is enough. Okay, you need to stop. And my brain made me become nonverbal. So whenever I got triggered, I couldn't talk. So I talked to Dr. Corinne Allen and I said, I need help. So she said, just drink more of the 8.5 water, drink as much as you can, but stay on the low water. That way your body will, your brain is not starving for oxygen. Because when your brain is starving for oxygen, your body causes you to go into anxiety and depression. So I said, okay. So I stayed at the 8.5 water for over a year. And I just kept drinking and kept drinking and kept drinking. My body hurt, but it didn't hurt anywhere near as bad as what it did when I was on the medications. And it didn't hurt anywhere near as bad as anything that I've ever tried in my past. And I am just so extremely grateful. But if I do not drink my water, I hurt. And all of my symptoms come back. I would much rather manage my symptoms with drinking water than taking a pill any day in my life, because this way my head is clear. I can speak to my son. I don't get triggered anymore from my PTSD. I don't have depression anymore. I don't have anxiety issues anymore. I've gotten everything under control. And it's all for, for the thank of Sylvia and Frank sharing a glass of water with me. And that's why it's so important for you. Just get the machine in your home, drink the water, continue to drink the water. Don't give up on it, because I'm full of arthritis. I'm full of so much inflammation. And as long as I continue to drink this water, it allows my immune system to do what it's supposed to do. And it properly hydrates me so that I can continue living my fullest life and be happy. And thank you so much for allowing me to share this opportunity with you. Now, one thing I do want to say, with my son's FPIES, he's 4 now. He started drinking this water when he was 2. He can't have milk, soy, and beef. He couldn't have it before the water. He knows this, and I know this, as we've tested it. If he does not drink enough water, he is up at night for 2 hours screaming with gas pains because he cannot release the gas on his own. It gets trapped in his intestine and in his bowel. We have this water in our home. He drinks it. He drinks enough of it. He sleeps soundly through the night, and he eats ice cream, or he eats whatever he wants to eat, and he doesn't have to worry about it at all. So people may say, it's a placebo effect. There's no placebo effect with a 2-year-old. I'm sorry, but there is not. And this started hydrating me better than anything in the world. I walked into my doctor's and I said, I need you to test me on everything you've tested me on before. And she was beside herself. She looked at me and she said, Kelly, I'm truly scared for you. I thought you were going to die. And I said, I was too. I said, but I knew I needed to do something. She asked me what I did. And I said, all I did was change my water. And she's, well, keep drinking that water. So I keep drinking my water, and my son keeps drinking his water, and we're able to do so many things. It's life-changing. Absolutely.